Okay, let's talk about infection control. As you know, right now, infection control is huge. And it is big for so many reasons. There's so many people that are in close proximity to each other. There are antibiotic resistance, all kinds of stuff, superbugs, all these things make infection control so very important. I want to talk a little bit about an exposure plan. Everywhere you work has to have an exposure plan. And where do you find it? In the policy and procedure book. And it has to be accessible to all employees. So if you were to be exposed, now what does that mean? You're going to be exposed to things all the time as healthcare workers, but exposed in a efficient way, in wearing correct PPE, personal protective equipment. However, there are other things that can happen, such as a dirty needle stick. Even though you may not be giving that injection, needles can be left places. Or what if, when you're doing a blood sugar check, right, you use the little lancets and you push the button and it's supposed to retract back in. That needle is, that little lancet is supposed to retract back in. Well, they're made by the millions, right? And they're made in a machine. Sometimes those will malfunction. And so if you were to check someone's blood sugar, do the glucometer reading and everything, and then when you're picking it all up, if that little lancet did not retract and it sticks you, that's considered a dirty needle stick. It's considered an exposure. Now, the reason why this is so very important is that policy you must follow, and you must follow it immediately. First thing you got to do always is wash your hands or wherever the site is, and then you have to go report it. You have to fill out an incident report, find that policy and procedure on that and follow it to the T. Otherwise, they may not have to pay if you do contract something from the incident. So keep that in mind. That's really important. Another thing I want to talk to you about is correct donning and doffing gloves. How often do you use that word? Don or doff? Never, right? But that's what they call it. To put on your gloves, they call it donning, and to take off your gloves, they call it doffing for some reason. So when you're putting on your gloves, this is a throwback from CMA. I should not have to tell you this yet. I know I better cover it, because sometimes in our busy lives we just forget things. One of my pet peeves is when I see people walking around with 10 gloves in their pockets. You know, they walk in a room and they pull them out of their pockets, their gloves. What else you got in your pocket? Your cell phone, your keys, some change for the vending machine, right? And you're putting your dirty grubs in there, in and out, back at, no, that is not appropriate. Now, if you want to keep one pair of gloves in there for emergency, I don't have an issue with that. It might be a good idea. But to shove your pockets full and use them as you go down the hall is really not appropriate, okay? Another thing is we don't always wear gloves when we pass meds. It really is not necessary, because you shouldn't be touching those pills, right? Never. So only time you'd wear gloves when passing meds would be if you're using a patch, putting on or taking off a patch. Remember, those drugs are designed to go right through the skin. So of course they will. They'll do just that, even the tiniest bit. So patches, you would always, any kind of a topical med where you're rubbing in a cream or a lotion or something, of course you would. An eye drop, I think that's completely appropriate. But just for your regular oral meds, no. Sublingual, yes. Yeah. But make sure the gloves are clean, not in your pockets for hours with other things coming in and out of them. When you put on gloves, You know, life's like a box of chocolates. You never know what you're going to get. So you pull it out and you don't know what you're going to get. So here we are. What did I get? Looks like I got a thumb. How about that? Now I try to touch it the least possible. So once I have this, I'm not going to touch it again on the outside. I can only touch it on the inside. So I'm going to go in there. Now I'm going to put these on all whopper just to show you that it's okay if this happens. Don't be pulling on it with your bare hand. Let it go. Okay? Then pull out your second glove with your gloved hand. Oh, aren't these great? Yeah, so with your gloved hand, see, now I'm not touching this at all. Now, again, with my bare hand, I only want to touch it on the inside as much as possible. With my gloved hand, I only want to touch it on the outside. So, see how I did that? Now I'm going to put this one on and then I'm going to show you how to rescue this poor hand. Now with my gloved hand, I can help this hand. See? And once you get good, I can do this. Once you have your task and it's time to take your gloves off, this is where I see a lot of people getting in trouble. And this can be a way of transferring germs. So it's very important we do it right. And if you imagine that your hands are utterly and completely dipped in poo, you'll do it right every time. In CNA class, I make the students rub chocolate pudding on their hands and then take off their gloves, just to really drive the point home. So I see all the time people taking off gloves like this. Well, do you see what happened there? Or like this? No, inappropriate. Instead, you pinch here and then push this in like that. As you take this glove off, inside out, you wad it up like this in the other hand. See that? Now, no, because now see how I'm contaminating? Instead, flip your wrist back either way. I like going like this, underneath. One swipe, just one pull. Not pull, no, just one. It's hanging on one finger and drop. Then wash your hands. That is really the best way to put on and take off your gloves, don and off. When it comes to the mask, most masks now have these ear loops. If you hold it up to the light, you'll see that one end has a little metal bar in it. That goes at the top. You try not to touch anything. That is your goal, is to touch the least amount possible. When the mask is put on, like that, pinch, pull, done. Don't touch it again, okay? When taking it off, take off your gloves first, then you take one finger like that and drop it. Nothing more than that should be done. Shouldn't touch it any more than that. Your gown, they only should be used once, not multiple times and hung up on the back of the door. Yes, I've seen that. I know they're expensive and I know it's a hassle, but these are disposable. Okay, you can't shake them, folks. You can't. You have to just open it up and let it drop. Okay, should not touch the floor. And when you put it on, again, you're trying not to touch anything more than you have to. You tie the top, you tie the bottom. When you take it off, gloves off. I always just say, just rip it, okay? And then untie or pull, break it, pull the gown forward and roll it. Roll it so that all the germs are going to the inside. Throw it away, wash your hands, all right? Next thing, if you're going in a room that's in isolation, it's inappropriate for you to walk in there with your blood pressure or your stethoscope that you take in everyone else's room. They should have a patient-specific disposable set in the room that stays in the room. Now, I know some places will have a Dynamap or an automatic blood pressure thing that they keep in that room. That's fine, but you can't be pulling them in and out of all these different rooms. If you do, if it comes out, it must be sanitized fully first, okay? Those are important. So isolation. We're talking about isolation. The main part we think of is protecting us from whatever they have. That's true to a certain extent, but more than that, you know, I've got a great immune system. Am I really that worried about getting C. diff or something like that? Probably not. I still want to take precautions, but I'm more worried about taking them from Flossie's room to Ernie's room to Mildred's room, because they don't have a great immune system. Their immune system has been compromised by other disease processes, illnesses, age. So with that in mind, remember, it's not all just about you, it's about protecting everyone. And then also remember about reverse isolation, where we are protecting that person from us. Even though you may not feel ill, we all still carry germs on us all the time. It's just because of our immune system that we don't get ill. But if you have someone in your facility perhaps who has gone through chemo or is on chemo or radiation or has a significant disease process or for some reason is really immune compromised, then a lot of the time we are going into the room with isolation to protect them from any germs we may have on us. So it's kind of a reverse isolation, so keep that in mind. Really, the spread of infection starts with us, and the number one way you can stop the spread of infection is what? Hand washing. That's right, hand washing. And you know what? If you're going in a room with isolation, you're like, well, I'm just passing the meds, I'm not going to touch her. Are you touching the light switch? Are you touching the door handle? Are you touching the head of bed to put the head of bed up to hand her drink and her meds? Then you need to glove and gown up. You need to do whatever PPE is in effect for whatever their situation is. Because infection control starts with us.